living la vida low carb. This show is changing lives. We talking about your diet, trying to get you feeling right. Cut up them avocados, fry some eggs. Time to explore the longest running health podcast, hosted by Jimmy Moore. Time to give up the crappy garbage. We're getting into ketosis. Every day is a new step to your goal. Yeah, you're getting closer, motivated and focused. Don't stop, just go. Time to get inspiration from the Living La Vida Low Carb Show. Hey, the livinglowcarbshow.com.
So guys, Dr. Caitlin Czezowski, I almost called you Czechoslovakia, because it's like Czechoslovakia, but I'm going to spell it for the people that might be listening on the podcast. It's Dr. Caitlin with a C, Caitlin and here's the funky monkey last name, Czezowski, and it's not easy to say. You say it one time so everybody hears it correctly.
Sure, Czezowski, or if you want to say the Polish way, not Czechoslovakian way, it's Czezowski. But I always say Czezowski.
Yes. So
it's easier.
So thank you for being here. I met you on Clubhouse. I started noodling around earlier in the year when Clubhouse was a thing. It's not quite as much of a thing now as it was a few months ago, but you were so articulate on a lot of different issues, a lot of them related to women's health. You came in and helped me when I did like my 7-day guided fast. We had 7 days in a row of at least an hour and a half to sometimes 2.5 hours worth of content. All of that's up on YouTube, by the way. Those of you that want to see, just go look up 7-day water fast Jimmy Moore. You'll find those videos, and Caitlin is featured very prominently on there. In fact, on one of my podcasts, Caitlin, I aired all of those back to back to back to back. It was something like a 16-hour podcast, the longest podcast I ever aired. But yeah,
I was going to say, oh my goodness, that's a lot of content.
Yes. So, but people found it so fascinating to learn all about fasting. Yes, I'm the king of pun. I'm going to do that here today. So, but tell us your story. You're into functional medicine. You are a chiropractor by training. Tell us how you got into functional medicine and why you felt like it was kind of the missing link in your health teaching with your patients. Yeah.
So I got into chiropractic actually. And side note, I was a snot. I was such a little snot at 19, 20, because I was going to actually be an MD. I was doing all of my pre-med stuff, and I've had headaches since I was like 10 years old and done every test, seen every specialist, and nothing was wrong, which is good, but I still had headaches, and I just wanted to deal with them. I would, push through them, just get through my day, because the meds made me super sick. Like I couldn't function. My grades were slipping when I took them. So I just dealt with the headaches. And then when I was an undergrad going through my pre-med stuff, my dad was like, Caitlin, you're always like holding your neck and you're doing this thing, and just go see my chiropractor. And I was like, yeah, like that, exactly like that. And so I did. And when you fill out the paperwork, I wrote like, I have headaches, I get migraines, that kind of thing. And they tried to ask me more questions about that. And I was like, don't worry about that. I've seen all of the specialists. There's nothing wrong. You can't do anything about it. Just make this feel better so I can study. Because I'm going to be a pediatrician. I wanted to work with kids. And within 3 weeks, my headaches were gone. And I was like, what in the world? I'm like, how is it that this chiropractor, which I didn't know a whole lot about at the time, was able to completely get rid of my headaches when I've seen every specialist, had all the testing, and nothing was wrong. And so that was really the first moment that I was like, okay, when there's something not right, there's something not right, and it means we just have to dig deeper to find out what's going on.
Yes. And then medicine just throws their hands up in the air and says, here, we'll cover it up with drugs, we'll cover it up with procedures, but there's really nothing you can do about it.
Well, and at one point they want the doctors wanted my parents to take me to a pain specialist because they thought it was all up in my head. They thought I was making it up. And being the oldest of 4, I was like, trust me, I do not want more attention. I'm good. No. Like, that is not it. So then I just stopped talking about it at that point because I was like, I don't want the attention. I do have headaches, but I don't like the drugs. So you just learn to live with it. And so that was actually the first thing that really changed my trajectory. I went into chiropractic school instead because I was like, okay, I can actually make a difference for people versus, just giving them drugs to try and cover up the symptom and,
Yeah.
Acting like a Band-Aid at that point. In
Yeah.
which case, I still got to work with kids. I became the first certified pediatric chiropractor in Denver when I graduated. So I worked a lot with kids in pregnancy, but my husband and I working, 70 plus hours a week, our health took a turn for the worst. And we had clients where we could get them better, but they would plateau and we could never get them 100%. And that was really when we started to dive more into the chiropractic philosophy, which is chemical subluxations, meaning chemicals that we're exposed to can cause a nerve interference. So when our nerves aren't functioning properly, there's going to be something wrong somewhere in our body, and it's going to be different for everybody. But it was my husband putting on 30 pounds in a month, even though we're super active, we eat really well, organic. We don't go out to eat, I cook. So that was really weird. And then for me, I had massive brain fog. And I have, if you ask my husband, my memory is pretty good. He calls it the vault. And when I started slipping on people's names and not remembering conversations and not remembering, did I do this? And that was in my later 20s, like my mid 20s. I was like, there's something not right. Like we're missing something. And that was really what pushed us into the functional aspect. And ever since then, it's been such a fun ride. It is amazing to constantly look at the physiology and go, okay, well, what could be causing the problem? And then figuring out per person what it is.
See, that's what I love about functional medicine practitioners like yourself. And I think it's probably the fastest growing sector of healthcare right now because people are sick and tired of going to a doctor who says you're just going to have to live with this the rest of your life. Throw their hands up in the air, throw more drugs at you, do this procedure, do that procedure, mislabel you this diagnosis when it's actually something underlying. That's so frustrating as a patient, and I try to be for patients, and it's just so frustrating. But most people don't have the gumption to push back because they don't know what to say. And so this is why I tell people, go find a functional medicine practitioner because they're going to be like Inspector Gadget, or what's that? Not Inspector Gadget. He has all the little tools.
Kind of. I joke that I get to play detective every
Yeah.
single time with new people because, just because somebody has the same symptom, like it could be weight loss resistance, it could be brain fog, it could be fatigue, it could be, menstrual cycle irregularities, whatever it may be, but it doesn't mean it's going to be the same per person. So the actual cause is going to be slightly different. So
Yes.
I think that's why this has maintained my attention for as long as it has, because it's never the same thing. It's always different.
Right. Sherlock Holmes was the name I was
Oh,
thinking of.
yep. There you go.
That came from. But yes, Sherlock Holmes, because it's like the mystery of medicine. And yeah, that's probably exciting for you because think about allopathic medicine people. They're stuck in a paradigm that has them very finite. This is your world. Drugs, procedures, and that's it. Whereas the world is this big monstrosity. When you open up and look for underlying causes, look for root causes of why you have those issues that you're dealing with, not just symptomatically, but the underlying issue that's causing those symptoms. That is what is missing in healthcare today.
Mm-hmm. Yeah, and it's actually, so I love and love and love that there's more and more individuals who are looking into the functional aspect. What I'm finding though is more and more functional doctors, because I've been doing this for almost a decade now, are losing the art of actually reading labs. So being able to look at labs and not just see like, okay, this is high, but being able to put it all together, because the way that I've always thought of it and the way that I explain it to my clients is every marker, regardless of whether it's from blood work or, hormone testing in urine or saliva, or we're looking at a stool test, it's just one puzzle piece. That's it. And if we don't put the whole puzzle together, we're not getting the big picture. And when we don't get the big picture, we potentially could be missing something.
Yeah.
So instead of just like throwing, lifestyle and diet changes and supplements and, medications and even anything, you're missing the big picture. And to me, that's actually the saddest part behind it. Because then I have tons of people who come into me and they go, oh, I've seen a functional doctor, it didn't work. Okay, well, what did they do? Let's see what's going on. And then it's just a matter of either putting the puzzle pieces together, finding the missing pieces, or looking somewhere else that wasn't looked before. So I guess really what I'm getting at is don't give up hope, keep looking, but make sure that you're looking in different areas. Try something different than what you've tried, because that might be exactly what you need.
Have you experienced the dreaded keto flu? Did you know that most of these symptoms are actually due to your body dumping excess electrolytes? This is where Element comes in. Element is a tasty electrolyte drink mix with everything you need and nothing you don't. That means lots of salt with no sugar. Element is formulated to help anyone with their electrolyte needs and is perfectly suited to folks following a keto, low-carb, or paleo diet. Element contains a science-backed electrolyte ratio, 1,000 milligrams of sodium, 200 milligrams potassium, and 60 milligrams of magnesium, with none of the junk, no sugar, no coloring, no artificial ingredients, no gluten, no fillers, no BS. Everyone needs electrolytes, especially those on low-carb diets, or if you practice intermittent or extended fasting, if you're physically active, or sweat a lot. Add Element today and see how much better you feel and perform. Use the URL drinklmnt.com/Jimmy.
Yeah, it was about 9 years ago. I was in Australia and I was visiting Sydney. I was speaking. I was one of the first speaking events that I had internationally. And I got to speak on stage, and this guy was a holistic dentist on the stage. And wonderful man. He ended up in my book, Cholesterol Clarity, as one of my experts. And he looked at me and looked at my teeth, as dentists like to look at people's mouths. And he said, "You've got high cholesterol." I'm like, how would you know that? Yes, I do. Very high cholesterol. It was in the upper 300s, maybe low 400s at the time for total cholesterol. And he said, "You've got mercury fillings. You've got clear infection. You taste anything kind of pussy or metallic in your mouth?" I'm like, "All the time." He's like, "You need to get that cleaned up with a holistic dentist." He would have done it for me there, but I was only there a short period of time, and you don't want to be traveling around with like all that tooth work done. So I came back here locally. You've come to see me here in South Carolina, you and Niles. And so I went to the neighboring town where a holistic dentist for about 10 grand cleaned up all of those infections, removed all the mercury, had the hazmat suit, and protected me from all the exposure to the mercury and cleaned it up. And within 6 months, my cholesterol dropped 100 points. Like, boom. It's all I did that was different. And so you're right. A lot of the doctors will see 300, 400 kind of something in the cholesterol and go, "You need a statin drug." You don't need a statin drug. You need to get to the root cause of why the body is pumping out more cholesterol.
Right, exactly. And I love that you brought up the dentist part, because actually the mouth is really the missing link, the missing piece to a lot of healthcare problems, whether it be those silver fillings, which I think we need to stop calling them silver fillings, because they're actually 50% mercury. The only reason it's called silver is because of the color, not because of what it's made out of. And people are still shocked to this day when I say that. And they're like, "What? There's mercury in there?" Yeah, there's a lot of mercury.
I have always called them mercury amalgams because I would call them something worse if I could. They really did. I had metallic taste in my mouth, and it changed the taste of the food. It was gross for the longest time. I just didn't know what I could do. And no doctor ever said, "Oh, you should get that teeth checked out if you want to lower your cholesterol." They don't know. They can't put the dots together.
Well, and it's not even like cholesterol is one of them. And doctors are now talking more about the mouth connection to cardiovascular disease, so heart attacks, because they're able to link back the bacteria in the heart to bacteria in the mouth, which is great, which is fantastic. I'm so glad that that's where they're looking now. But there's so many other things. Like, I don't think most people and most doctors even realize that, okay, if somebody's doing everything right, like they're eating clean, they've done low carb, keto, they're intermittent fasting, they're doing it properly, and they're still struggling, like they're not seeing the results that they should be, a lot of times it can be linked back to the mouth, whether it be silver fillings, or if they had silver fillings, had them removed, but didn't have them removed by the right type of dentist, because
Yes.
not every dentist is the same. But regardless, even if you have them removed, if you don't remove the bioaccumulation of mercury, because those fillings, they off-gas, which means they're constantly releasing mercury the whole time that you're in your mouth. And
Yeah.
here's some things that like speed up the off-gassing, which is crazy because people are like, I kind of do that every day. So every time we brush, every time we chew, so if you chew gum or if you chew food, every time we drink something hot, so if you're a coffee drinker, a tea drinker, you eat soup, you eat hot food, it's going to speed it up. Every time you get your teeth cleaned, if your dentist has ever told you you're a grinder, so if you grind your teeth at night, all of that increases the amount of mercury vapors. And those vapors go everywhere from like the pituitary gland, which is the master controller. That literally controls your thyroid. It controls your adrenal glands, which controls our sex hormones, our metabolism, our body temperature. It controls our stress response. And those are just like two of the places it goes. It can also go to every cell in our body. So mercury loves fat. Guess
Yeah.
what every cell has? A biphospholipid membrane, which is fat.
Yes.
And our body goes, wait a minute, we have a lot of toxicity right now. We don't want you to lose the weight. We're just going to hold on to this because if you lose weight, those fat cells shrink, all those toxins get pushed out. And if your body can't handle it, your body goes, nope. So it's actually saving you. As much as you're frustrated and angry and pissed off, your body's saving you.
Thank you for bringing that up, because people get frustrated. They're like, oh, it's so hard to lose that weight. I'm like, you don't realize the body has a very sophisticated mechanism to protect your dumb ass sometimes, because you don't know what you don't know of what your body's trying to protect you from. And this is also why when someone makes some change, let's say they go on a fast, for example, fasting mobilizes body fat pretty hot and heavy, and then they start to feel bad and they blame it on the fasting, when actually what it is kind of a detoxification taking place. I know you're a big fan of this is when you're fasting, you should probably take these things called binders, which can grab those toxins and get them out of your body quickly so you don't feel the effects of them.
Oh, 100%, because regardless of how many times you fasted, regardless of, if you've done detoxes before, and every detox is different, there's some detoxes that make you poop, which there's a time and a place. If you're not pooping, we got to poop, because otherwise we reabsorb those toxins that our body's trying to eliminate. But we're exposed to toxicity every single day, from the air we breathe, depending on where we're at, to the food we're eating, if we're eating conventionally grown vegetables. And I'm not here to promote organic or anything like that, but if we're eating food that's sprayed with pesticides, those pesticides, our body has to figure out what to do with it. And then we throw in, like Jimmy Moore's hair care products and my makeup and, everything that we use on a day-to-day basis, from our cleaning supplies to our laundry detergent to air fresheners. We're exposed to toxins. And so every single time we fast, our body's using that as a means to eliminate some of the toxicity that has built up in our body. So much like you said, some people feel pretty crummy doing a fast, and then they associate it with, oh my gosh, fasting's bad for you. I don't feel good. It makes me sick. Actually, yes, because your body's backed up. Your detoxification pathways, whether it be your liver, your kidney, your gut, because you're not pooping. It could be your lymphatic system if your lymphatics aren't moving. Something isn't moving it out. And so using a binder to kind of like a catcher's mitt to catch those toxins, to eliminate it, is super important, because the last thing you want to do is fast, move those toxins from one location to another, because it could actually cause you more problems in the long run.
So is the binder like activated charcoal? What are some of the binders that you use?
Yeah, so it really depends on what's going on, but a super easy one that I love actually is it's called Bind. It's a systemic formulas one. Another one that I love is True Carbon Cleanse, and really the reason I love those is because they are activated charcoal with other things in there, whether it be a zeolite or fulvic acid or apple pectin. There's all sorts of other binders in there, but the reason I like those ones is they've been tested for purity. And the last thing we want to do is using a binder, because binders, that's what they bind. And if we're using charcoal is in nature, right? If it's in a contaminated, area, it's already going to have toxins in there. And the last thing we want to do is take something that has toxins to bind up our toxins, but to potentially toxify ourselves even more. So we just have to be mindful of the sourcing and like where we're getting it.
And this is why getting one at your local drugstore, vitamin store is probably not necessarily a good idea, because the efficacy, they may have toxins in them, then you're putting them in your mouth and you're getting exposed to that. Absolutely.
And don't get me wrong, I love when we can go and pick up supplements from, a local store, whether it be collagen or whether it be, I don't know, what else could vitamin C, like a buffered vitamin C, something that's a little more inert where it's not meant to absorb toxins. The moment that we're using something to absorb toxins, we just want to make sure that that thing itself doesn't already have toxins in it.
Yes.
Keto Chow is a customizable shake mix that is also perfect for cooking and baking, giving you simple, nutritionally perfect meal options. Keto Chow. Make keto easy. Discover your favorite flavor at jimmylovesketochow.com.
So I want to go back to the mercury just for a second, because I meant to ask this. It's fascinating just jibber jabbering with you, my friend. So the mercury, once it kind of is in your system, can you do some chelation therapy, some EDTA, which is a chelator, to help remove some of that? Would that be helpful?
Yes, and you got to be careful. So whenever we're using supplements or chelators, so chelators just means that it's moving a toxin, and the idea is for it to remove it from our body, not just to remove it from the liver cell or the pituitary cell or the thyroid cell or the fat cell, wherever it is. So we have to be mindful about half-life. And this is something that drives me absolutely freaking bonkers with a lot of heavy metal detoxifications, is they're not taking into consideration the half-life of whatever they're using. So like if we're using EDTA or DMSA or a zeolite or, IV chelation, how long is that half-life? Meaning, how long is that going to stay in our system moving things around before it just stops working? And so what concerns me, and don't get me wrong, I love IV. I think IV is amazing. I don't love it, however, by itself for chelation therapy because of the half-life. Like, you're not hooked up to that IV for 24 hours. You're hooked up for like 1 hour.
1 hour.
And then, the half-life for most of the stuff is right around 12 hours. So then what happens 13 hours after the IV is done? All of that stuff just gets redistributed. So a good mentor, a good friend of mine, Dan Pompa, actually uses the analogy of, those street sweepers and how they go in to clean up all of the dirt and the dust. Well, they make the roads clean, but it's not like they're sucking up the dirt. They're just like shimmying it around, putting it into the air, and it's going other places like the boulevard and the sidewalk and into the bushes and the trees. And so it's really just redistributing it. And so if we're not careful when we do detoxification with heavy metals, we have to be careful not to just redistribute the heavy metals. We have to make sure that we're eliminating them. Otherwise, I've seen lots and lots of unhappy individuals for that.
Yeah, I've actually witnessed, there's a guy here in South Carolina. I don't know if he's still in practice because he was older than dirt like a decade ago when I saw him. Sorry, whoever you are. I know his name because that would be disrespectful. Let's just put it this way. He does chelation exclusively, non-insurance, so he doesn't have to play that game. And he has people come in from around the world and they do the 1 hour IV. And then he's simultaneously, while he's chelating, putting vitamins back in their body, because the chelation doesn't just remove the toxins, it also strips you of some of these key nutrients. So he's putting those back in. Would there be benefit if they stayed on it for 12 hours?
So I work a lot with naturopaths, and I do like IV chelation when we put it in conjunction with some oral chelation
Yeah,
therapy. So
yeah,
that way, after the IV is done, you can still at home take some chelators so that you're
yeah,
still binding up. And that's where a binder still needs to be
yeah,
used, binding up everything that's been like pushed up into the air. That way it's not just going to move from one spot to another. So it's not to say that IV chelation should never be used. I just think it needs to be used in conjunction with
yeah.
other modalities.
Agreed. And I think I have actually seen like cadmium and mercury and various heavy metal go down in not just one way of measuring. You can look in the blood, you can look in the urine, you can look in the stool. You see it go down in all of those places. So, I mean, there is definite benefit. If you've never heard of that, you guys, actually, Dr. Atkins wrote about this way back in the early 1970s. I was still in diapers, Caitlin. And he wrote a book called Dr. Atkins' Health Revolution. If you've never heard of that book, you could probably get it for like $1 on Amazon. And he talks about chelation, a lot of these therapies that now you probably use in your practice, Caitlin. He was kind of the trailblazer. Everybody thinks of him as the diet guy, but he knew a lot about the natural health and functional medicine kind of principles that are now common practice.
Well, it's funny that, you know, there's certain things that we've known and done as a species for millennia. Like fasting is one of them. It is one of the strongest healing modalities when done properly.
Yeah.
Same thing with like low carb. When it's done properly, it is so super healing. Keto, paleo can be extremely healing. There's so many different things that can be done to be very beneficial, but we have to do it properly. And it's funny to me that this has been going on, like this is how our ancestors lived, and yet there's so much backlash and so much pushback for decades until it becomes common knowledge. So, you know, some of the things that you and I talk about now that there's still a lot of pushback on, they're like, no, that's not right. That doesn't work. That's ridiculous. You know, women should never fast, and I'm sure we'll get into that. I don't believe that, by the way. So for those of you that are listening, but, you know, within 20 years, there will be more knowledge around it. And the reason that is it takes 20 years for today's science, today's research to actually be implemented in the medical system. 20 years. Like that baffles my mind. And so by then, like 20 years from now, that's going to be like older. There's going to be newer, better methods to get quicker results because of the different biohacking and the research and everything else that we have going on. So it's unfortunate that there's so much pushback for natural things when in reality, does it take a little more effort? Probably. Does it take some time? Absolutely. But long term, are you going to get better results? 100%.
You went there, so let's go right there now with the women and fasting. And I'll tell you, it was right about a decade ago. I was in the paleo community, and there was one girl who tried a fasting type of approach. I think she was only doing just intermittent fasting, and she had a quote bad experience. And so she writes this very prominent post that went viral on the internet that says women should not fast. And so it became this mantra: women, it's probably a bad idea to fast. And she started talking about menstruation issues and started talking about hormonal imbalances and all these things. Now, she's a very science-minded blogger, so I don't want to dismiss her concerns, but it was highly anecdotal, and people thought they treated it as if it was a study declaring this as a true statement. But I know many women that do very well in fasting. You're one of them that does extremely well, and you implement it, you know, periodically with both intermittent and some what do you call them, block fasts instead of extended fast. You call them block fasts. So make the argument for why women should fast, and then how is it different than what guys can do?
Sure. So I think what we need to stop doing as practitioners and as society is putting women and men in the same box for everything, because we're not the same. We are not men with smaller figures like that. we're not the same. We have cycling hormones every day, every month, you know, and the argument behind it is our ancestors fasted. They didn't have fridges, you know, they'd go days without eating and their body knew how to. But the trick is to not overdo it. So we can't fast the way that men can. We have to be mindful of our hormones, because if we're not eating at certain times of our cycle, and I'm specifically talking right now about menstruating women and perimenopausal women, if we're not eating at certain times, what's going to happen is our body is going to go, oh, we're in a famine state. We don't produce progesterone, so we can't get pregnant, and because it wouldn't be a good time to bring a child into this world. And if we don't have progesterone, then we have other problems like depression, we get moody, we don't want to get out of bed, we have fatigue, we have brain fog, like all of these other things start to happen. And so I think what happened with that specific blogger, and what a lot of women do, myself included, because when I started fasting, I did it so wrong. Like, oh my goodness, did I do it wrong? I'm the type of person where I'm very type A, very driven, and seeing my male counterparts fasting, I'm like, oh, I can do that. I can do it. I can do it better. I can do it longer. Yeah, I could. However, I changed my hormones. So my hormones went in the toilet. Like, my cycles were awful. I had massive brain fog. I had low energy. I was very short with Niles, my husband. Like, I could pull it together for my clients because you can't be short with them. But I was not fun to be around. And the reason that was I was fasting. I was doing longer fasts too often, which we can talk more about that. But I was specifically doing longer fasts. So when we talk about intermittent fasting, I personally believe everybody should be going 13 hours every day with no food. And so 13, it's easy, because 13 hours actually in cancer studies have shown that not eating 13 hours reduces the likelihood of the reoccurrence of cancer. So it's like, hold on.
And look at what that is. You stop eating a few hours before bedtime, you go to bed, you wake up, you don't eat right away. That's 13 hours. Like, it's not hard.
No. And that's what I tell people all the time. Like, okay, depending on what time you wake up, like if you're a really early riser, like somebody over here, which I can argue the fact that I think you're more of a night owl than I am, waking up at 2:30, but that's besides the point. But no, if you wake up at like 7 o'clock every morning, then just stop eating 7 o'clock the night before and don't have anything till 8. Like, that's super easy. Like, do everything else.
Including bulletproof coffee, guys. That will break the fast. Let's stop pretending like bulletproof coffee, oh, it's okay because you're still fasting. No, you're not. You're keeping insulin down, sure, but fatty coffee is not fasting, right?
So, no, and so I'm a purist when it comes to fasting. When I'm fasting, I'm fasting. I'm fasting. Yeah. I'm only taking in water and salt. And it really depends. So for me, when I'm working with somebody, what is their goal? Where are they starting at? Are they starting with the standard American diet? You know, are they used to eating every 2 hours to try and keep blood sugar level? Like, guys, I taught this 10 years ago, and I cringe now thinking like, oh my gosh, what in the world was I teaching my, you know, insulin resistant clients? Like, I was teaching them to eat every 2 hours to keep blood sugar stable, and I was actually doing more harm than good.
That's right.
So anywho, I always reserve the right to change my opinion based on science and research, because I am human, and you know, as we learn and as we continue to learn and grow, we can continue to expand our mind and expand our practice and knowledge and everything. So, but I'm with you. I'm the type of person where it really depends what you're looking for. If you're looking for a true fast, water and salt. If you're looking to just not eat, like taking a break from eating, then okay, maybe have a bulletproof coffee or a bulletproof tea, and that will prevent you from eating because it'll fill you up, because there's a lot of caloric density, which is great. It's good, healthy fats. But is it doing the same thing? Some will argue yes. Some will argue no. But you have to figure out.
It depends on what you're quantifying. Is it keeping insulin low? Sure. Are you maybe turning off some of the growth hormone? Are you turning off some of the autophagy when you have that? Probably.
Yeah, like I said, it really depends what you're looking for and the results you're looking for. Yeah. And I really actually encourage people to listen to your body. If your body's like screaming at you, like you're hungry, if it's true hunger, then eat. Like, don't push through it. If
Yeah.
it's not true hunger, because unfortunately most of us have lost the ability to understand what true hunger is, because we
Yeah.
don't have to go hungry. Then I recommend doing drink some salt water and see if you're still hungry. Like really
Yeah.
test if you're hungry or if it's more of a habit thing. Because I'll tell you, like when I'm not trying to fast, I can go all day. I can even go like
Yeah.
36, 48 hours and be like, oh gosh, like I've just been so busy with
Yes.
writing clients or whatever it may be. But the moment that I set it in my mind that, oh, I'm going to do a block fast, I'm going to do a 5-day, a 7-day water fast, day one is like the hardest thing in the entire world, because I'm like, oh my gosh, I could be having a fatty coffee, or, oh,
Yeah.
it's dinner time and I really want a salad with some grass-fed beef. And, so it's all mental. Half the time it's mental, but it's a matter of figuring out the difference.
It's day two for me that gets me every time. I can survive day one because I do a lot of OMAD already, 1 meal a day. But day two is a bitch. So it
Day
can,
2 and 3 suck.
yeah.
2 and 3 suck, and they always suck, guys. They never get to the point where, like, you could be doing this for years like I have. Day 2 and 3 always suck. You're
Yes.
exactly right, Jimmy. They always suck. It's never like you get to day 2 and you're like, woo, this is a breeze.
Although I will tell you something I have implemented as of late. Don't think I've really shared it anywhere publicly. I talk to people all the time, kind of behind the scenes. But the 3 days leading up to going on a block fast of, say, 7 days, and I want to talk about your block fast that you do, the frequency and how long you go. But the 3 days leading up, I eat a crap load of fat and protein. I mean, really even pushing satiety right to its brink, just so I'm well nourished, well supplied with the fatty acids and the amino acids, so that when I start, day one is definitely going to be a cinch, but day two, it still sucks, but it's not as much. And I have found that to be a really strong strategy to make sure that I'm well nourished going into a fast, because when you feast, you feast. When you fast, you fast. We kind of need to really honor that.
100%. I always have my clients go low carb, very low carb, a few days up to it, because if we're eating the standard American diet and we're using fasting almost as like a punishment, I hate that. Oh, I ate a whole bunch of carbs the day before. I had some wine and I ate the cake and I had the French fries, and okay, you feasted. You don't have to go the next day and fast and like abstain from eating, because actually it's going to be harder just because you ate all of those carbs. And then you're going to beat yourself down because emotionally and mentally it's going to be much harder. And then you're going to be like, if you're anything like me, gosh, just pull it together, figure this out. You can go through this. Like, don't be a failure. It's crazy, the stuff that we do. So I 100% agree. I always, when I'm personally doing it, I go low carb. It depends how far in advance. It depends how long I'm going to go on a water fast. But going low carb makes it so much easier. So much easier. Thanks for bringing that up.
Real Good Foods is one of the fastest growing frozen food companies in the U.S. Everything they make is nutrient dense, high in protein, low in carbs, and made from real food ingredients. They make food for every occasion: breakfast sandwiches, poppers, enchiladas, entrees, and pizza. So whether you're on a keto diet, trying to cut back on your carbs, or just trying to eat healthier, they make super convenient and tasty options. RealGoodFoods.com and at Real Good Foods on social media.
Yes, and for you, you have very strategic block fasts that you do. Tell us that protocol of what you do. How many a year do you do? How long do you go? And why do you not go longer than this period of time? You have a very specific reason. I'll have some commentary about that as well.
Yes. So, there's a lot of research out there, and it shows that if we all do 7 days water fasting once a year, it reduces the likelihood of us developing cancer by like over 90%. Like, it's crazy.
Yeah.
And so if we all just did one 7-day water fast a year, we would be so much healthier. So I will do one 7-day fast once a year. And then every about 4 months, I'll do anywhere between a 5 and a 7-day water fast, depending on what I have going on. So if I'm super stressed out, I'm not going to do it because fasting is a stressor on the body. And, you know, when we're stressed out and our cortisol is already up, it's not the best time to do it. It's just going to be harder. So, you know, from experience, that's happened to you before. And I'd love for you to share that story. But I will typically do, you know, for sure 3 5 days or 2 5 days and 1 7 day every year. And the way that women have to do it, because it's different. Men can do it whenever the heck they want. There's really no like timing it with the moon or timing it with the time of month. You don't got to do that, you guys. But women, we do, especially like I said, if we're menstruating or perimenopausal. So for me, I always time it typically day 2 of my cycle. I don't like doing it day 1. Day 1's that's the last thing you want to do day 1. Like you start your bleed, you don't really feel great. So I personally choose not to do it day 1. I typically tell women to do it when it starts lightening up. So when it's not such a heavy bleed. So depending on when that is for you, that's when I would start it. And the reason that is because we're not really producing a ton of hormones at the moment. We're building up to it. So the best time to do longer fasts, even like 24 hours, 48 hours, 36 hours, 5 days, 7 days, is during our follicular phase. So the first part of our cycle. So days 1 through roughly 14 if you're on a 14-day or 28-day cycle. If you're on a 14-day cycle, we got to talk some other things because that's not okay. But so the first roughly 12 days is really great to do those longer fasts, especially water fasts. When it's not okay to do it is day 17 through the next bleed. So whenever that is on a 28-day cycle. And the reason I say that is, you know, a few days after we ovulate. So if we're going on that 28-day and we ovulate on day 14, day 17 is when progesterone's supposed to come in. And that's where earlier when I said, if we're not eating even enough carbohydrates, like I actually see keto and low carb harming women long-term doing it improperly too, because we're not eating enough carbohydrates for our body to produce the progesterone necessary. And so that's the big reason why women get the whole, well, women shouldn't fast and it's not healthy for women to fast and do low carb or do keto. No, it is. We just have to do it differently. So nothing longer for me, honestly, because sometimes when you feel good, you just feel good. I do not recommend longer than 16 hours for sure, like definitely not longer than 16-hour fast, the last 10 days roughly of your cycle. So the first 10 days, first 12 days, fantastic, go long hours, do water fast, but then not after that.
I see the law of diminishing returns over 7 days. I've done many over 7-day fasts just to show you can do it. But I don't really find that much more of a benefit going beyond 7 days. Plus, if you go 5 to 7 days, you can go again quicker than if you go 21 days and you have to wait for months. 5 to 7 days, you can do it again in 3 to 4 weeks. So it allows you more frequent, I guess, into the autophagy and all the benefits that you get from it. Whereas, yeah, you feel good and you feel like you could fast forever, and you do, by the way, once you get to that point. But I just find it's better just to end it, start again in a few weeks, and do it again if you choose to. For the record, I don't think everybody needs to fast long. I think most people, like you said, could benefit from at least that 13-hour fast. I think 16-8, 18-6 for most people probably gets them most of the benefits that they would get. I want to tap on the carbohydrate thing leading up to the bleed, because that's going to be interesting to a lot of my followers, because I have a lot of carnivore people that follow me, and they love their animal-based foods diet. So how do you guide people that want to eat that way, women especially, that are still menstruating? How do you guide them about cycling in carbohydrates, and what are the carbohydrates?
I always get asked, like, what about raw vegan? What about veganism? What about vegetarianism? What about carnivore? What about paleo? There's a million different ways to eat, and I think they all have benefits. The question is, how long are they beneficial, and what do we have to do to keep changing it up?
Yeah.
And so if someone's going to do carnivore, I think that's great, do it. But make sure you're eating snout to tail. If you're only eating, muscle meat, you're not getting the vitamins and minerals necessary to sustain yourself.
Yes.
So you have to be eating brain and intestine and liver and heart and tongue and, you know, some of the less glamorous cuts of meat to get it in. So that's the first thing you got to do. The second thing is when people go, well, what type of foods help support progesterone? And it really does vary. Beans support progesterone. If you don't do well with beans, though, because I don't do super awesome with beans, there's sweet potatoes. There's tropical fruit like star fruit and passion fruit that really help progesterone production. So it's just making sure that we're getting some of those healthier carbohydrates. And when I say healthier carbohydrates, I'm not saying go get some Wonder Bread, go have a donut. That's not the healthy carbohydrates. It's getting some of the fruits and the vegetables in to help support progesterone.
Yes. And again, this is for you ladies who are still menstruating, and it's the week-ish leading up to your cycle beginning. And so it's so important to hear this kind of information, which is why I wanted to have you on here today. I do want to get into a few other topics since we are running out of time. Inflammation gets a lot of lip service, but I don't think a lot of people really understand all the ways inflammation impacts our body, and that it's not just one thing. We talked about toxicity earlier. That definitely raises inflammation. That's why my cholesterol rose in my body from the mercury and the infections with my root canals that got infected. The reason cholesterol went up was it was trying to keep that inflammation under control. The reason you deal with abdominal fat is your body's trying to protect you from inflammation. And so talk about how you explain this to your patients.
So inflammation is actually your body's response, and it's very healthy, truthfully. Think about it. Like if we jam our finger playing basketball, our finger swells. The reason our finger swells is because there was some damage done, and it's swelling to prevent us from being able to use it so that it can heal. If we continue to use it and it's been injured, we run the risk of causing more damage. Well, the same thing happens, but most people don't understand that they have inflammation because they can't see it, right? Like we can see a swollen finger, we can see a swollen ankle or knee or whatever it may be. But inflammation internally is doing the same thing. It's trying to heal. Inflammation brings all of these things to the area, like different cytokines and things like that, to help speed up healing. But the problem is not inflammation, it's how long we have it. So it's that chronic inflammation that is problematic. So anytime that we are exposed to toxins, and again, I'm not anti-drugs. I think there's a time and a place for medications, prescription drugs. But every time we take it, it's not just the active ingredient that we need to bring down our cholesterol, bring down our blood sugar, increase our thyroid. There's a lot of other things in there that our body has to filter out. So if we're taking that every single day, that is a chronic, low-grade, stressor ultimately that our body has to deal with, not to mention, the hair products. And if we have silver fillings, or if we have a hidden infection like a root canal or a cavitation, or if we have Lyme disease, or if we have mono, or if we have, underlying shingles or whatever it may be, our body's constantly trying to protect itself by producing inflammation to try and speed up the healing. But inflammation will also break us down. So if we let the inflammation in our fingers stay around for too long, eventually it breaks down the joints, it breaks down the ligaments, and the same thing happens internally. So if we're not being mindful about where is our inflammatory exposure coming from, is it that we're plugging Glade plugins? Are we using balanced dryer sheets? Because dryer sheets are one of the most toxic things that we do. We make our clothes smell fresh for months on end, which, by the way, that's not normal. Like, our clothes shouldn't smell like a field for weeks on end. But our skin absorbs the toxins from those bounce sheets, whether it be our clothes or the towels we dry off with or the pillowcase that we're sleeping on, we're breathing it in. And so we just have to start figuring out, okay, where are our biggest sources of toxins and how can we make shifts? How can we make little changes that'll make a bigger impact long term?
And see, when you talk that way and people haven't heard this information before, people think you're crazy. Like, what? But think about it, guys. When you have a strong scent, even like that Febreze, when that first came out and said, spray it on your carpet, spray it on your curtains, spray it everywhere. And oh, it smells so good. And yeah, if you could see like all those toxins going up your nostrils and then filling your body, I wonder if anybody ever did a study of people that use that product, not just that product, but that product came to mind under the guise of, oh, it makes you smell, it cleans for you. And it cleans how? It takes away, it masks odor, but what is that doing to your body?
Yeah, it's one of those things where, like, when I start working with somebody and I just have them make some quick changes, like take out the dryer sheets and switch it out with wool dryer balls. You can add essential oils. You know, if you want your room and house to smell good, get a diffuser with some organic oils and your house can smell like whatever you want. Same thing with your car. You will actually start to notice a difference. And the crazy thing is you notice it more. So when I walk through department stores and people are loaded with perfume and colognes, it's nauseating now because I'm like, oh.
I can smell people's laundry detergent on their clothes. That's how strong it is on my schnauzer.
Yeah, and that just goes to show you that now your body's actually able, because it's not constantly bombarded with that toxicity, that it's able to recognize it now. So it's crazy, like making these little slight changes, because I'm not telling you to go through and like ransack your house and flip your life upside down and, you know, drive your spouse crazy and your kids nuts. And no, just make little changes. And those little changes over time become habits. And then as you start to build, you can make bigger changes. And that's really when we start to see the long-term benefits of, you know, living a healthier lifestyle.
Right. Well, and that exposure to those toxins over time starts to chip away at the gut lining. So then you start having leaky gut, which then leads to autoimmune. I know you do a lot of work with autoimmune disease with your patients, and a lot of it isn't just food. I think we put the rightful amount of energy looking at food, and it should be looked at. But I don't think we put enough of the emphasis on the right syllable when it comes to all the other things that could be impacted. Things like leaky gut, things like autoimmune disease, things like hormone dysregulation, endocrine imbalances. Like, those are things that I'm glad people like you are out there to help articulate them, because quite frankly, you're not going to get it from allopathic medicine. They don't really know a lot of these things. And so thank you for the work you're doing. Guys, again, Dr. Caitlin, I'm going to try it again. Czezowski.
Good job.
Did I do it? Okay.
Yeah.
Czechoslovakia was here today. Thank you so much. Again, I'm going to spell it for those of you on Instagram. She's Dr. Caitlin with a C, Caitlin Czezowski. I'm gonna get Niles for having that crazy last name.
No, that's actually my maiden name.
Oh, is that your maiden name and you just kept it because you were a functional medicine doctor before, or you just kept it?
Yeah, no, I graduated before and I was like, forget this noise.
Yeah.
I am who I am.
You could be Dr. Chez.
I usually go by Dr. Caitlin, honestly, or Dr. C.
I call you Caitlin all the time on Clubhouse when I see you on there. So definitely, guys, look her out. She is a podcaster as well, and she's a speaker. She has the dental detox, bite-sized health, a mouth body expert, fasting expert. Definitely, again, go check her out on all of her work. Caitlin, I'm so happy we got you here today on my show. Sorry for this technical issues.
Oh, I'm sorry. I was like, oh my goodness, seriously? Come on, what's up with this? But
you know what?
Thank you so much.
That was a test of your resilience with stress, and you handled it quite well.
Well, you know, you figure it out. You roll with the punches, because it's one of those things. You can't control everything in life. You can just control what you can and, you know, enjoy doing it while you're doing it.
Yes, that is the spice of life, as they say. Well, Caitlin, thank you so much for being here. And guys, thank you so much for watching. We'll be back again soon.
Get inspiration from the Living La Vida Low Carb Show. Hey, the livinglowcarbshow.com. Woo!
You tired of playing the mask game? Me too. That's why I wanted to tell you about the Unmask. This is a breathable, completely breathable. It covers, you can't even see that it's breathable, but it's breathable. Whether you're going on a plane, having to go into a store and wearing this thing, playthemaskgame.com is how you can get this mask. They come in all kinds of colors and everything. In fact, right there, you can see right through it what it is, but when you're wearing it, it does not look like it's anything different, but it's breathable, baby. Playthemaskgame.com.